the Director of the Centre for Longitudinal Studies, and I'm also a principal investigator of one of the 5 cohorts in which we've done a special COVID-19 data collection that this training session is on. So it's been great to see all the interest demonstrated by so many people signing up for this training session. And we're here essentially to tell you about the new data that we've collected and to give you some insights into how to use it and what's in there. So the running order for this morning is as follows. Brief introduction from me. I'll then hand over to my colleague Richard Silverwood, who will tell you about the construction of and using the non-response weights, which we've included in the data that we've deposited at the UKDS. Then my colleague Pravitha Patale will tell you about the mental health and well-being questions that are in our survey, and also Viladsen will tell you about the time use question, and she'll also wrap up and close. So as Richard said, we'll each do a presentation, and then there'll be some time for question and answers in between each of our presentations. So I think if there's any burning issues of clarification that you'd like addressed while we're talking, I think we can handle that, but mainly we'll go for Q&A afterwards. So I'll tell you a bit about the data collection in detail in a moment. First of all, what was the aim? So this is data collection which has been embedded in a number of long-standing longitudinal studies that have been following people over a long period of time, 4 of the 5 studies since birth and 1 since the study members were in adolescence. And our aim has been to understand the economic, social and health impacts of the COVID-19 crisis, the extent to which it's widening or narrowing inequalities. And you can see here the part that I've highlighted in blue, the lifelong factors which shape vulnerability and resilience to its effects. So the fact that the data collection is in nationally representative samples and embedded in studies which have been following people across life, I suppose emphasizing here the lifelong factors is really one of the very unique aspects of the data for us to be able to do research which builds those into the understanding of the impacts of COVID. 5 studies that are taking part. So the lower 4 on this chart are the 4 that we run here at the Centre for Longitudinal Studies, the 1958 National Child Development Study, the 1970 British Cohort Study, Next Steps, and the Millennium Cohort Study. And we've also been working in close collaboration with our UCL colleagues at the MRC Unit for Lifelong Health and Ageing, who run the 1946 Cohort Study, the National Study of Health and Development. So collectively, these studies are all of the UK's national birth cohort studies that have been running since post-war and going strong today. Next Steps is not a birth cohort, as I said, but started in adolescence. And that's the full collection of cohorts that we've harmonised and issued this data collection in. So I think there'll be varying degrees of familiarity among those of you who have signed up to this training session about what these studies are and what's in them and their history. This cohort age and timeline gives you some sort of snapshot overview of that. So you can see for each of the studies along the x-axis, the age, so a life cycle, age from birth onwards, and on the vertical axis a year. And you can see for each of the data collections, essentially the blobs are, for each of the studies, the blobs are when we've had major data collections within each study, and the year in which those, the age and year in which those have been. So you can see there the NSHD is the oldest study going down to the millennium. And at each decade, if you sort of look from the ground up vertically, you can see where we've had data collections in each decade of life within each of these studies. So where does that get us today? The age of the cohorts at the time of our first COVID data collection, and I'll say a bit more about plans going forward in a moment, you can see reading down here. So the Millennium Cohort study members are age 19, and I'll just add that we also issued the sample to Millennium Cohort study member parents, who are of course a range of ages, but all have a 19-year-old child. The Next Step study members are age 30, BCS 70 are currently age 50. They all had their birthdays just when the lockdown started. NCDS are age 62 and NSHD are age 74. So as well as being a resource to look at the lifelong factors that affect resilience or vulnerability to the effects of COVID, you can see that it's a resource for cross-generational comparisons. Okay, so in terms of the data collections that we've done, so we carried out what we're calling a wave 1. We don't mean wave in terms of the COVID infection, but just wave in terms of survey wave. We carried out our wave 1 in May 2020 at what was essentially the fullest part of the lockdown. Data collection took place from the beginning essentially through to the end of May. We have a wave 2 in full preparation, which we will be launching at the very end of this month, and it will be underway from the end of August through September, what we're calling eased restrictions, though it's looking increasingly like there'll be local lockdowns as well. And wave 3, we're aiming essentially late 2020, November, possibly December. And I think we're not quite sure what the social distancing restrictions and so on are going to be around then. Okay, so what was in our first survey? Here's a list of topics which we covered. I won't go through it in detail, but you can see that we've covered a range of topics around health and healthcare, physical and mental health, things around people's families, employment and finances, education, particularly for the Millennium Cohort study. We have a question on time use that Alissa is going to talk about later, a number of questions on people's attitudes, including trust in government and local community, and we've been working on a number of linkages into the survey as well. So a set of geographical linkages should be available soon, and also we encourage study members to sign up to the King's College COVID symptoms tracker, and we're working on linking at the individual level the results from the symptoms app and results from the study. So in terms of how we approached asking questions on these topics, well, we were very interested in people's circumstances at the point at which they were interviewed, so in May, and where we could. We also framed the questions for to ask just before the coronavirus outbreak and during. So not all questions lent themselves to a before and during structure. So for example, time use, we just asked for a day last week. We didn't try and collect time use just before the outbreak compared to after. But for many questions, there's a before to after element in them. So the questions were harmonized across all 5 cohorts wherever that was possible, but we also worked very hard on ensuring longitudinal continuity within the cohorts. So the cohorts have not always asked exactly the same questions in every cohort at every time. So we made our best judgment in terms of both longitudinal continuity and harmonization. So when Pravitha comes on later, she'll talk to you in detail about that in terms of our approach to the mental health questions, for example, where we asked some harmonized questions across all of the cohorts, as well as some scales that had been previously included in specific cohorts as well. So what data is now available? What can you get your hands on and use? So we've made a first deposit of data at the UK Data Archive. You can see here, screenshot from there. It's study number 8658. It contains data at the moment on end user license for 4 of the 5 studies. So the 4 CLS studies are currently deposited there, and there is a special license data deposit of the NSHD data from our colleagues at the LHA unit, which we're expecting to be deposited this summer. So you can get started on the 4 CLS cohorts, and then you can work on the NSHD data set as soon as that's available. And there'll be slightly different access arrangements for the prior longitudinal data for the NSHD compared to the CLS ones, where all of our data is essentially available at UKDS already. So you can start to do that longitudinal linkage yourself straight away by downloading from UKDS. So finally, we are also preparing a set of briefings using the data, and I know some of you are both data users and users of our research. I hope you'll click into this link and look at some of the early findings that we have already put out in the case of the first two on this slide on finances and employment and on parental involvement in homeschooling, and also a further briefing on mental health, which will be put up onto our website tomorrow. And that's a screenshot of what it's going to look like. So thank you very much indeed. And if you have any questions, I'm going to look in the chat box and see what comes up. So thank you.
Alissa, I can't see any questions at this time. Shall we move on to the next segment?
Sorry. Hello. Sure. If I guess now, if you don't have any questions, then I'm more than happy to cede the floor to Richard.